how to approach palpitation in cases. We should have the structured approach to palpitation cases to find out the causes, the sign and symptoms, and then the workup and management. We should decide on the basis of the history and examination, and then we should consider the complications. So the palpitation we should divide into three parts: palpitation cardiac origin, palpitation non-cardiac origin, and the third one you can say the psychological disorders leading to palpitation. The cardiac causes of palpitation, we should think about the arrhythmias like supraventricular tachycardia, atrial fibrillation, atrial flutter, ventricular tachycardia, premature atrial contraction or premature ventricular contraction. Then the palpitation can also occur with structural heart disease like valvular heart disease, mitral valve prolapse, can occur with hypertrophic obstructive cardiomyopathies, and can occur with other congenital heart diseases. Other cardiac causes, then we should rule out the patient is having the pacemaker inserted due to any reason or no. The pacemaker induced arrhythmias could be there. Then the other rhythm abnormalities like long QT syndrome or Brugada syndrome should also be considered in cardiac causes. Non-cardiac causes, you should think hyperthyroidism like this case, hypoglycemia, anemia, and then due to electrolyte imbalance like hypokalemia and hypomagnesemia. Then we should also include the drugs and the other factors that can increase the heart rate and causing the palpitation. Like I discussed just now that we have to take the history of coffee intake, alcohol intake, nicotine intake, energy drinks, cola drinks. These all very important to ask. This could be the cause also in some scenarios. In cases like the scenario came that the patient is taking excessive coffee together with smoking history, and that was the only finding in that patient. So I have this case. I remember this case. It came in basis in some centers. So this is very important to ask. Not only this could be the cause of palpitation, but this could be the contributing factor, or this could be the triggering factors of the underlying disease. So very important to ask. Then we have to ask like sympathomimetic drugs patient is on, like our patient was on salbutamol inhaler, and some decongestant can lead to this. Amphetamine, cocaine, and ecstasy. These are the recreational or illicit drugs that can lead to increase heart rate and palpitation. We have to rule out fever history. We have to take the infection, dehydration, and we have to consider pheochromocytoma also in our differentials. Then the psychological disorders like anxiety and panic attacks, somatization disorders. So psychological history is very important to take. In the history, we have to ask some question. Do you feel that you are aware, you have the awareness of your heartbeat? Yes, I feel like my heart is beating, and I feel my palpitation or my heartbeat is beating, heart is beating. So it is rapid or slow. This should be the question, rapid or slow. Sometimes the bradycardia also is coming like palpitation. Rapid or slow. Then the next question, regular or irregular. Okay, where is the palpitation? Palpitation is a cardiac symptom or chest symptom. So we have to ask the other chest and cardiac symptom at the same time. We have to complete the chest part or the cardiac part of history now. Then we should proceed to the other histories. So we have to ask, do you have any chest pain together with this palpitation or the heart beating? Any chest discomfort or chest pain? If there is chest pain, then full history of chest pain we should take in the chest discomfort. What do you mean by chest discomfort? Then you have to ask any difficulty of breathing. Okay. Then you have to ask if the difficulty of breathing is present, then the further questioning of difficulty of breathing should be there to rule out orthopnea, paroxysmal nocturnal dyspnea, dyspnea on exertion is there or no like this. Then the cough and the sputum production and then the fever history just to complete the chest part because this palpitation is related to the chest. Then the other questions, then other review of the system you can do according to your differential diagnosis. So you made the differential diagnosis and different causes we have discussed. So you can ask the question related to this. Try to find out the pathway, which way the patient is going. Like in this patient, it was going in favor of endocrine related disorder. Then you have to ask a specific question related to that. So once Dr. Vikash found that the patient is having like weather preference, she is unable to tolerate the hot weather, then you should ask heart racing, hand shaking, hand sweating, and then what about your bowel habits, increased frequency, and increased frequency of the bowel habits, and the stool is towards the looser side or increased frequency is there. Then what about your appetite? Appetite is good or increased. What about your body weight? Despite of the good appetite, patient is losing weight. And if it is a female patient, then the menstrual history, there will be oligomenorrhea in such situation. Okay. Then you have to examine the patient. From the hands, we have to check that tremors are there or no, sweating is there or no, and then any thyroid echopathy features are there or no, clubbing is there or no. We have to feel the pulse, count the pulse, and to rule out the tachycardia, tachyarrhythmia features and bradycardia, bradyarrhythmia features. Then we have to rule out the atrial fibrillation. Then we have to check the blood pressure. Then we can offer like RPS checking, blood sugar. Then we will move towards the arm of the patient to check the proximal myopathy. Then going towards the face of the patient. So hyperthyroid features. So we have to think about the eye manifestation. We have to think about the neck manifestation. We have to think about the cardiac manifestation of hyperthyroidism. And then the leg examination. Okay, sometimes it is related to palpitation related to anemia. So in eye examination, we will check the tail conjunctiva is there or not. So this is how we can examine the patient and then the investigation or the workup. It will be depending on the your findings on the history and examination. Then you will tell the findings or the workup accordingly. Okay. In cardiovascular system, you have to see like any murmurs is there or no, any signs of heart failure is there or no. Okay, thyroid examination we will do now in detail. Eye examination also related to thyroid we will do in detail. Yes, I want to finish now this palpitation approach. Workup should include ECG to rule out any arrhythmia, QT prolongation or ischemic fringes, and Holter monitoring might be required, echocardiography to rule out the structural heart disease. Sometimes exercise stress test and electrophysiological studies can also be considered. So these are the investigation for palpitation. Then to find out the cause of palpitation, like in this patient, you can go for thyroid function test and then antibody testing, anti-TSH, anti-thyroglobulin antibody, and thyroid peroxidase antibodies. Other investigations like you can do full blood cell count to rule out anemia, electrolyte imbalance we have to rule out, so we will do the electrolyte checkup and glucose monitoring if diabetes related is there. Okay, so management, we have to see whether the patient is hemodynamically stable or unstable. If the patient is unstable, like hypertension, chest pain, or syncopial attack are going on, then we have to take the patient seriously and we have to see what rhythm is going on. If it is like SVT, atrial fibrillation, or ventricular tachycardia or ventricular fibrillation, we will go for synchronized DC shock. And we will take the urgent cardiology input. If the patient is stable, you have time to proceed gradually. Like this patient is having hyperthyroidism, so we have to consider to control the rate. We have to inform the patient to stop smoking and to stop alcohol intake for now. And we have to treat the underlying cause. So beta blocker, if it is contraindicated, Dr. Vikas rightly said that we can go for calcium channel blocker, or the other option is we can go for cardioselective beta blocker. Treat the underlying cause, whatever it is, and then proceed from there. And if the patient is having like if the patient is having any serious arrhythmia, then we have to give anti-arrhythmic drugs also specific according to the rhythm. Long-term management, we should inform the patient that you have to do lifestyle modification, you have to stop smoking, you have to decrease caffeine intake, you have to decrease alcohol. Stress management and relaxation technique, very important. Exercise, it's important to control the rate, beta blocker or calcium channel blocker. If it is atrial fibrillation, then control the rate or the rhythm. The cardiologist will decide. If it is arrhythmia related, then the antiarrhythmics like flecainide or amiodarone. If it is atrial fibrillation, we have to think about anticoagulation also. Then we will do the scoring like SHATS, WASC score. Okay, and then sometimes we have to go specific treatment like catheter ablation for SVT or atrial fibrillation. Sometimes we have to place the ICD, implantable cardioverter defibrillator for a specific arrhythmias. What could be the complications of case with palpitation? So if it is atrial fibrillation, it can lead to stroke and other complications. And if it is related to some structural heart disease, patient can develop heart failure. And if it is like lethal arrhythmias like ventricular tachycardia and ventricular fibrillation, patient can have sudden cardiac death. Also, hypertrophic obstructive cardiomyopathy, patient can have sudden cardiac death. Psychosocial complications, we have to manage whatever the situation is. We have to take the psychiatrist input to treat the anxiety and depression and to improve the quality of the life. So this is all about the palpitation approach, how to approach the case of palpitation.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.